Perfect. Good morning, Chair and members of the board. Thank you so much for allowing me to speak. My name is Dr. Heidi Sikora. I'm a retired nurse practitioner, doctor of nursing practice, and healthcare executive. I serve as the volunteer chief scientific officer for the nonprofit International Plant and Herbal Alliance. My background is in developing evidence-based clinical guidelines across oncology, heart failure, brain injury, wound care, and geriatric care, grounded in rigorous data evaluation and patient outcomes. So basically, my career has been spent balancing the benefits and harms and determining what leads to the best outcomes. I have no financial interest in Kratom. I am very supportive of regulation for Kratom, especially the Kratom Consumer Protection Act that actually limits the amount of 7-OH to natural levels in the plant. I do want to acknowledge the parents who have spoke that have lost an adult child. Their grief really does deserve respect, and nothing I say about the evidence is meant to diminish that loss. I would like to just offer brief scientific clarification that might be supportive. First of all, natural kratom is not a drug. It's a botanical that's been used. The leaf of the tree from Southeast Asia has been used culturally and also for hundreds of years in the United States for several decades. Um, so there's a very important distinction. It actually contains more than 50 naturally occurring alkaloids. After harvest, a very small portion of mitragynine can actually form a small amount of 7-OH by natural oxidation, but those are micro levels. The trace levels are far below any known pharmacological threshold, not extractable or commercially usable, and have not demonstrated harms. A small fraction of mitragynine is metabolized through the liver into 7-OH, but that's only like 1 to 5%, resulting in very low physiological levels. These normal metabolic levels likewise have not been linked to any adverse effects in scientific literature or adverse event reporting. When serious adverse events are reported, they almost always involve factors such as polydrug use, adulterated products, concentrated extracts, or significant pre-existing conditions, not natural kratom leaf. I think it's very important to remember that natural kratom and its most abundant alkaloid, mitragynine, does not recruit the beta-arrestin pathway that is associated with respiratory depression. This is what makes it so very important to have legal access to natural kratom. Classical opioids, as we know, the mechanism of death is from respiratory depression. So when people are using natural kratom as a harm reduction tool, as opposed to using some synthetic opioid or overusing opioids, it's not going to lead to that respiratory depression. So I think that's extremely important to remember. I also wanted to reiterate what Mac Haddow had said about the 8-factor analyses, and that's that evaluation process that you've been discussing. An 8-factor analysis is a gold standard to determine if a substance should be scheduled or not scheduled. That has been done multiple times at the federal level, and the World Health Organization also recognized that the natural leaf kratom does not meet the criteria for scheduling it. In addition, Concordia School of Pharmacy also did an 8-factor analysis, and they supported the conclusions that the FDA had come to. So I just wanted to give you that as a reference in case, save you some time from having to redo that whole process. You might want to look at those. So 7-OH in concentrated form, that's a semi-synthetic substance. It is nothing like the natural plant, and I definitely encourage action, whether it be legislative or by the Board of Pharmacy, to remove that from the market. I think I think I've covered pretty much everything, but I just want to thank you so much for the opportunity to speak, and I appreciate your time.